So as we do here on this program, we get a chance to talk to Dr. Sergio Alvarado from the Desert Institute of Sports Medicine and throw different topics at Dr. Alvarado. First off, welcome back. I like your background. I feel like I'm talking to you from Southwest University Park. Nicely done.
Right. Yeah, I think these guys did a fabulous job. So we like it. And the patients seem to like it.
That's good. I haven't spoken to you in a couple of weeks. How are things been going for you, Doc?
Good. It's been busy. I think a lot of the athletes are wrapping up the school year. And of course, we always have our other patients that have their aches and pains from all these from, I guess, just being 65 or older.
That's exactly right. I mean, let's be honest. And I'm curious about this. How many of the people that you see that are over 65 don't really have a lot of pain? Are there some individuals that are so blessed where their bodies aren't really breaking down and they're still in great physical shape even into their mid to late 60s?
Yeah, every once in a while, like that, and it's there's I guess the fountain of youth for all those it's always exercise and of course avoiding, like they usually come with the same background. They've never smoked, never really drank. Their BMI is under 30 and then they do exercise. One of my oldest patients, she's 98 and the first time I saw her, she was 95 and she was showing me all her yoga poses on the floor there at the clinic. And I'm like, stop, please, and very strong lady, and she's very, very sharp. And I have another one that she came for an ankle sprain and you look at her and she looks, probably late 50s. She's 74 and she dances 5 hours on Saturday, 5 hours on Sunday.
That's terrific.
Yeah.
Meanwhile, folks, for those of you that are tuning into this for the first time and have not had a chance to hear Dr. Sergio Alvarado on Sports Talk before, he is El Paso board certified in medicine with an added qualification in sports medicine. Now, they've recently expanded their location at 2267 Traywood, Suite G2. And parents, summer is right around the corner. After all, it's getting into the 90s now. The Desert Institute of Sports Medicine will be offering summer specials for sports physicals for just $25. All you have to do is call us up an appointment, 915-256-9751. Now, Doc, I wanted to bring up the topic of steroids today, because even though we've seen a lot of professional sports crack down on steroids and human growth hormones, I think that there's still some people wondering about the impact it can have on the body, especially for athletes that are as young as their teenage years, and all the way up to obviously college and professional athletes.
That's right, Steve. I think some people still are under the false misconception here that they can get the I guess that what they are thinking is their gains without a heavy price. And of course, we're talking about anabolic steroids and not corticosteroids. Corticosteroids are the usual like anti-inflammatories we use in the office for arthritis, osteoarthritis, rheumatoid arthritis. But yeah, the topic is that what you're talking about here and what we're talking about is anabolic steroids, the kind that we use for muscle enhancement, and they do come with a heavy price. I was talking to Adrian earlier, and we were talking about every I would say every 2 months, I get somebody that's using them, and of course they kind of go around the topic, but and eventually they come clean and they're like, hey, yeah, doc, I'm using steroids. I just want and I kind of already know that one of the side effects is increased blood pressure. And so you have this young 20-year-old with high blood pressure, and you're like, geez, like this is pretty high, acne and usually, acne, like, of course, with hormones, it could be at any age. And then this imbalance of labs, that you normally not see in a healthy 20-year-old. So yeah, it comes with a price, and I think people still are under the misconception that, hey, I use it for just a little bit and I can gain muscle without paying the price.
It's a shame because you're right. There are more bad than good, but sometimes the people get sick and a doctor puts them on a Z-Pack and a steroid just to feel better. That's different than some of the steroids that people use, especially also things like that will replace testosterone loss and things like that as well.
Right. And so that's, I think sometimes too, it's important that like, our listeners are know the difference that we're talking about anabolic steroids and yeah, you get sick or you get you have pain and at that point you're getting corticosteroids, which is a whole different beast. And while those also have their side effects, they do have the benefit of helping the inflammatory process, like shutting it down and bringing it down.
Do you feel like over the last 15 or 20 years, as professional sports has cracked down on steroids, you're starting to see less and less use around, athletes here in, let's say, El Paso and other cities around the country?
Unfortunately, no. I think people are diving, deeper into, denial and really just hiding. I remember in high school, two friends of mine that were wrestlers that were really actually very competitive, at the state level. I remember they were approached by somebody, at their gym, about using steroids. And I mean, this is obviously a long time ago, and I'm thinking, hey, you know what, are those days gone? And they're not. I'm still seeing, like I said, that some of the young, and I have different. We approach schools. We talk about it in some of the sports where you see it more. The powerlifting, or even in football players that were, we were talking about linemen where they want the size and they want the power at the same time. They're still used and maybe not as much. I guess I would say it's still kind of about the same, unfortunately. And as you go up the ranks and the collegiate level, I think the competitiveness and having that competitive edge is more important. And I think it happens more, and that's why they need to crack down on this. I mean, you look at what happened in the Olympics, just recently.
Is it also possible, Doc, where athletes could get the same type of results physically from weightlifting, proper diet, and using supplements that are perfectly legal and beneficial to the body without those harmful side effects like you could get with steroids?
Well, that's the hard part, because it will take more work. But sometimes, you're not gonna get that you're unfortunately, that you won't get the gains as fast. And I think that's probably why, at the end of the day, we're this is a shortcut, and with any shortcut, medically, like there's always a downside. And I think they could do, they will still have some gains, but possibly not as much, on the muscle building. And that's the problem, and so the thing is, then you start talking about, hey, like, what are you using it for? Are you using it just for show, or are you using it to get a competitive edge? And I guess that's where I think it gets tricky, because in the spirit of fairness, then you got an unfair advantage.
I always think about Hershel Walker, who never lifted a weight in his life, never took steroids. He just had a very simple regimen of thousands of push-ups, thousands of sit-ups every day. It still does them. And, you looked at him physically, he looked like a guy that was an incredible physical specimen, muscles everywhere. And yet it was all from just doing push-ups and sit-ups.
Yeah, and the thing is too, like, I mean, the genetics, like there's some people that are just going to be stronger. I mean, those same two friends I was telling you about in high school, that they they were high school athletes, and they were pretty fit for their age, you know.
I get it. If you had to give advice, though, to youngsters right now, especially those that are playing high school sports and with dreams of going to college, especially as their coaches are telling them to hit the weight room, get bigger, and gain muscle mass, what's the best advice that you give all the young athletes out there, Doc?
Well, I say, keep the conversation open too. Of course, some of them might not have a pediatrician, but they also the great thing about El Paso is the majority of the schools have great trainers, and they're a great resource. And exactly what you said, there's no shortcuts, and don't use the shortcuts. Work out harder, use the summer, and you might be a little bit bigger, but use the summer to kind of catch up. And you're going to have to work harder, at the end of it, but it'll pay off, because in the end that's you don't risk any bad outcomes physically, or even just getting in trouble with the legalities. And if you're going to go on to the collegiate level,
How early do you recommend youngsters start with weights and weight training? Is there a certain age where you usually tell people, hey, don't even try starting with weights until you get to a certain age?
Yeah, it's usually at the high school level is kind of where I say, hey, you start having the changes, and of course you're having these growth spurts. The main thing I emphasize too with this age group is I tell them, look, get with somebody that knows how to lift weights, and because in the end that's where you see a lot of the injuries too. People overdoing it and having they load up the plates, and their form is horrible. And then you have these injuries that resulted from just bad form.
And the truth is also that as important as weight training is, and getting larger and gaining muscle mass, diet is a huge part of it when you're really talking about trying to have get the most out of your physical body when it comes to sports.
That's right. And so, the thing is too, you got your 3 macronutrients, you got your proteins, your fats, and your sugars. And of course, the big with any diet, like all you're doing is you're kind of switching the percentage that you're taking. But that's why I tell them, look, if you're going to increase your protein, make sure you're involving your pediatrician, your primary care. So they're keeping an eye on your kidney function, and they're telling you, hey, this is how much you should be taking, and you probably shouldn't be taking more than that. And then also trying to get some lean protein also, not just a lot of times, when we think of protein, we're just thinking of hey, eat an extra chicken breast, or take a double portion of a steak, but you can have leaner protein as well. Vegans, a lot of times, people think oh, these guys aren't going to get big, and they find their way because they find alternatives with their protein, getting their protein from beans and from even sources like hummus.
Doc, we talked the bad side of steroids, but can you give us a little breakdown of the good side of the steroids, like the positive ones that you all offer, and what benefits they could offer?
Yes, and so we talked about the corticosteroids, and patients with arthritis, what's lacking is the cushion between the joints, and so it's either diminished or gone, and you got 2 types of arthritis: osteoarthritis and rheumatoid arthritis, and that leads to a lot of inflammation and pain. And so these are the people that come and they're saying, hey, my knee hurts, my shoulder hurts, my hands hurt. And sometimes it's just wear and tear, like a mechanic, a construction worker, and they can benefit in the sense that they get pain relief and can do their daily activities. It's also about quality of life, and pain is not a good quality of life. And so helping them with their pain and by bringing down the inflammation is pretty much what they do. So yeah, the thing is, who would be a candidate? Somebody that's having joint pain and it's not going away. You've tried, just resting and it's not going away. It's getting worse. It's time to look into it and see what's going on.
I've always been told cortisone shots can reduce inflammation when you have it. Is cortisone a type of steroid?
Yes. So cortisone is a corticosteroid as well. And we kind of, I guess sometimes to the docs, they just say, hey, I'm going to give you a cortisone shot, but cortisone is we don't use it as much. We use its big brother, triamcinolone, and we use dexamethasone. They're both corticosteroids. All three are corticosteroids. I'm sorry. And we use those more because they last a little bit longer. But yes, the thing is, we use it for joint pain and say, hey, you know what? My shoulder's hurting. I want to get some relief. But there could be a downside to it, and the downside is you are injecting it into the joint itself, but some of it can leak out and cause your blood sugar to go up, and of course that's not good in diabetics. Long term, it can start kind of affecting the tendon, and then that's not good in younger folks, younger athletes, and it can just like any joint injection, sometimes it doesn't work. The arthritis is far gone, and it becomes a surgical issue.
Dr. Sergio Alvarado, folks, is El Paso board certified in medicine with an added qualification in sports medicine. Now, the Desert Institute of Sports Medicine recently expanded their location at 2267 Traywood, Suite G2. And parents, summer is right around the corner. The Desert Institute of Sports Medicine will be offering summer specials for sports physicals for just $25. You can call to set up an appointment, 915-256-9751. Well, Doc, once again, we have flown by on another week of Ask the Jock Doc, and hey, we appreciate the time and look forward to doing it again with you real soon.
Thank you, guys.